Now, World Hepatitis Day is being observed today to raise awareness of viral hepatitis and inflammation of the liver that causes severe liver disease and cancer. This year's theme of the day is It's Time for Action. With a person dying every 30 seconds from a hepatitis-related illness, we must accelerate action on better prevention, diagnosis, and treatment to save lives and improve health outcomes. To discuss the world's deadliest virus after COVID-19, we have guests in our studio, Mr. Cary James, who has been a chief executive of the World Hepatitis Alliance, WHA, since 2019, and Dr. Aftab, the president of the National Academy of the Young Scientists. So I'll go to my guests now. So welcome to PTV World, Dr. Aftab and Cary James.
Thank you. Thank you very much.
Yes. So, Cary James, can you explain the significance of the World Hepatitis Day and why is it important and is observed globally?
Absolutely. So World Hepatitis Day really marks and brings attention to one of the world's most deadliest viruses. There's over 300 million people affected by hepatitis B and C around the world, and there's 1.3 million deaths each year, and that number is rising. So World Hepatitis Day is a very important day to mark and remember the many lives that have been lost, and to really fight for greater attention for hepatitis, greater investment by both global and national institutions, and to really empower communities and people living with viral hepatitis around the world to advocate and fight for their rights and better care and treatment.
Right, thank you so much. And also, Dr. Aftab, can you tell us that what are the main challenges Pakistan is facing right now in combating the hepatitis?
Well, the real challenge is unawareness. So, you know, in Pakistan, the cases are on the rise, and right now, we are at #1 in terms of hepatitis C infection. So, that's a real challenge. So, the number are rising. Just like I mentioned, that hepatitis C, we have top now in the world in terms of number of infections. So this is one of the challenges that we have to raise awareness. People are unaware, and many people, they even don't know. According to recent reports, 9 out of 10 people even don't know they are suffering from hepatitis B or C infection. So there is need of massive screening programs in Pakistan so people could be aware. And if they will know that they are suffering from infection, then they can start like the early treatment so they can have a better treatment outcomes.
Right, thank you so much, Dr. Aftab. And also, Mr. Cary James, can you tell us the role and what do public awareness campaigns especially play in preventing the spread of the hepatitis?
I mean, it's absolutely essential that the public is aware of hepatitis and how to prevent it, but also the need to get tested and the need to access treatment if you do test positive. And it's also very important for mothers to know that before birth and while they're in their antenatal care, that they should be asking their physicians to be screened for both hepatitis B and C so they can get the appropriate care to prevent hepatitis being passed down to their newborn child.
Also, as you know, that Egypt becomes the first country to achieve the WHO validation on the path to elimination of hepatitis C. Now, what Pakistan can learn from Egypt in hepatitis prevention and control? Mr. Cary James, please carry on.
Sure. So, I mean, Egypt is a shining example of what can be achieved if you really have the government, the community, and the private sector behind you for a major elimination program. And I think very similar outcomes could be achieved here in Pakistan. And there's the government of Pakistan has just launched its new strategic framework for both hepatitis B and C, which is really a very strong commitment to the elimination of both of these diseases. And it's a combination of strong support by the government, a strong community and civil society network like you have here in Pakistan, and really partnership with the private sector that can really make that happen.
Right. Thank you so much, Cary James. Now, Dr. Aftab, can we discuss the government's current initiatives and programs aimed at controlling and preventing the hepatitis in Pakistan?
Well, there are several programs that were launched initially as well. So there are like now hospitals at the Tehsil level. They are working for the diagnosis and treatment. They are in action now. There is a national program as well. There are provisional programs working in Pakistan, but they are having a limited scope. There is need of more concrete actions, and that's why the Prime Minister office is going to launch a new program that is going to start tomorrow, and Cary James will be part of that program, so he will be there. So I think as we know that the cases are on the rise in Pakistan, and if we talk about both hepatitis B and C, Pakistan is ranked at number 5, but if we talk about hepatitis C cases, we are at the number 1. So there is a need of just like Cary James mentioned, that all the stakeholders should be involved, and government they are going to take this action, and they will launch a program so we can follow the examples of Egypt, and similar program can also be started in Pakistan, so we can have better treatment, better diagnosis, and better prevention in Pakistan.
Absolutely. And Mr. Cary James, can you tell us about the common misconceptions about hepatitis?
I mean, there's many misconceptions about hepatitis, unfortunately, because hepatitis around the world carries, a really unfair stigma. And I think some of the most common misconceptions is that you can catch hepatitis B or C just by being near someone or by touching someone's hand. B and C are both only transmitted through blood, so that's completely impossible. I think another misconception commonly is that hepatitis B and C are most commonly transmitted through sexual contact. And that's also not true. I mean, although it is possible, the vast majority of cases of both hepatitis B and C are either from mother-to-child transmission or from unsafe injecting practices, poor hospital hygiene, or even poor hygiene in barbershops and tattoo parlors and piercing parlors. So I think those are the two of the things that really get in the way of hepatitis response, because until we get over the stigma and support people with hepatitis and realize that they are just like everybody else, the sooner we can do that, the sooner we can really push forward on elimination.
Absolutely true. And Dr. Aftab, how can the international organizations and other countries support Pakistan in its fight against hepatitis?
Well, this is very important because, just like the polio program in Pakistan, and there is a lot of international support. Similarly, there is a need of international sport in Pakistan in terms of diagnosis, because in Pakistan we don't have the data, and data is very, very important. So if we have a massive screening programs in Pakistan, only then we can get the data. And to launch those massive screening programs, there is a need of international support. So there could be rapid diagnosis, there could be diagnosis through the PCR, that's the confirmation. And all those, if we go for sophisticated tests, then there is they are quite expensive. So there is a need of support for those programs. Moreover, this is for the diagnosis. So first thing is we have to go for the massive screening, and we need the support for that. Another is the hepatitis B vaccine. So I should tell all the audience that there is a vaccine for hepatitis B, but there is no vaccine so far for hepatitis C. So B vaccine is very important for the prevention of infection. So if you get the dose at the very early stage, just like the child that is born, if we give the dose in 24 hours, then we can prevent the infection. So in Pakistan, unfortunately, we have very low vaccination rate, and there is a need of international support. If we get the support, we can provide those vaccines to the children, and also we can do the massive screening, and we can provide the vaccine to all the people who are not infected with the virus. So for these massive vaccination program, we also need the international support. In addition, the treatment, that's the third option. For hepatitis C, we had a very good program in Pakistan, and Pakistan has the cheapest treatment for hepatitis C in the world. So that was also through the international support, and this support should be continued in Pakistan, so we can have better diagnosis, we can have better prevention and better treatment in the country.
Right. Also, Mr. Cary James, can you tell us about the early signs of the hepatitis, if the one is transmitted from somewhere, maybe because of hygiene, or maybe through, from anywhere. So what are the early signs, in the early stages, what are these signs that when a person can know about that there's something wrong with them, and so they can go for the diagnosis?
Well, I mean, the truth of it is that hepatitis normally doesn't have any symptoms until you're already progressed into the first stages of liver disease. And that's why it's so important for everyone to get tested, even if you don't feel unwell, even if you perhaps you didn't think that you could have been exposed to hepatitis, because by the time the symptoms do appear, you've already suffered liver damage. But I mean, things like yellowing of the eyes, jaundice, and things like that are obviously really strong warning signs to go get tested as soon as possible.
Right, and lastly, Cary James, what message would you like to convey to our viewers about the importance of getting tested and vaccinated against the hepatitis?
Well, as you mentioned before, the theme for this year's World Hepatitis Day is time for action. And that applies to everyone. That applies to governments, that they need to invest in hepatitis programs, for doctors to be better at developing their practices to support hepatitis elimination, but it also applies to every one of us. So each of us has our own role in our own lives to stop hepatitis. And the first stage of that is to get tested. So I really would encourage everyone this World Hepatitis Day to get tested for hepatitis, to know your status, because then you can do the best that you can to protect your health and the health of your families.
Right, thank you so much, Mr. Cary James and Dr. Aftab, for joining us and giving us the details and on the Hepatitis Day and the significance and the importance of getting to know these factors and getting to know these stigmas about the hepatitis and how important it is to get diagnosed and get to be aware about this serious disease. Thank you so much, Dr. Aftab, and thank you so much, Cary James, for joining us in PTV World.
Thank you for inviting us. Thank you.